Hi, and welcome to our next topic. And in this topic, we're going to be discussing the importance of mental health and emotional well being on the journey of chronic kidney disease. And we have two very special guest speakers with us. This afternoon, we have Dr. Suresh Shankar, a senior nephrologist from the city of Chennai. And then we have with us Bonnie Schneider, the founder of IGAN Foundation and also a caregiver to a son. And let's start off with Dr. Suresh. Can you talk to us on mental health on the journey of CKD?
Thanks, Marianne, and nice to be with Bonnie and Vasundhara on this initiative by Kidney Warrior Foundation. I think it's a great topic that I feel that Indian nephrology and the kidney care space in India has not given adequate weightage to over the years. So I think the first thing I would say is, if you talk of kidney health for patients mental health for patients with kidney disease in India, I would sort of tend to look at it from two aspects. One is the personal aspect of the patient, and then is a unique aspect from the health system perspective. When I say the personal aspect, it's about patients getting diagnosed with it, the anxiety and the fear and the haziness that lies in front of them about the diagnosis and therapy. And I think that is a kind of a global phenomenon that happens for any patient with kidney disease in any country. You cannot belittle it, and kidney disease, like any chronic condition which is with its seriousness, carries it. The second dimension that is very unique to India and maybe several other countries, which is similar to it, is what is called the health system context. What I mean from that is the fact that you have to spend for the care by yourself. We still do not have insurance, be it public or private. So the financial dimensions of it add to the disease dimension. I mean, so the ramifications of that, the fact that it'll impact your work, you're caught with whether you can hold on to your job because of the disease, how you're going to spend for your care. And that adds considerable distress in patients, in addition to the disease diagnosis. And I think that is unique, not for India alone, for any low and middle income countries, unlike the developed nations of Europe. I think that adds more complexity. So having said that, I think okay, fine, this is what is carrying the weightage on the patient's shoulders. When we encounter patients, I think there are some, what do you say, broad brush of culturally how Indian patients tend to be. I think first and foremost, we are the more expressive and maybe a hyper emotional way of dealing with situations. The second dimension that we see from patients is also we're more collective, in the sense the doctor-patient interaction doesn't happen as so much as a one-on-one. There is always the broader family along with it. So the weightage of the presentation is just not on the patient, what we spoke about, it's also the life partner or the extended family of a sibling or of parents, whatever it may be, based on whom you're seeing. Now, then what happens in the Indian context is you're presented with the whole emotional reactivity of the group, and it's not so much of the individual. So I think if you're sitting on this end of the table as a doctor, it's like you're drinking from a fire hose, because you're absorbing the emotions of everyone. It's good to be collective, but sometimes when it presents like this, it can be quite a task to handle. So that's kind of how it comes on. But when you say, okay, fine, you learn to handle it, and you kind of understand, you learn to handle families where the power center of this group is. It could be the eldest brother in the family, it could be the father or the mother. We kind of have to go through the group to tease it out. Then we sort of encounter certain unique aspects, some of it related to gender issues. because if you see the data from India, be it patients on dialysis or patients on chronic kidney disease, you'll see 70% are males, 70-75%, and 20-25% of women. So, which is not how kidney disease incidence is in the community. The health seeking, there's a distortion. So you will see a lot of gender issues uh, influencing how the engagement happens. The second dimension that is very unique is something that creates an ethical conflict, which is shielding information from the core person who's affected by the disease. It is how the group behaves. An example is the patient wouldn't come, and the elder brother or the parent would want to have an appointment with the doctor and have the conversation. And again, how things work and how privacy of information works in India, it's such an open book. So they would actually walk in, and then you are saying, "Oh, well, I'm okay with talking to you. Could I have him in the conversation too?" And that is very unique and challenging. That's another dimension that you have. And of course, you learn how to navigate these things, but these are quite unique provider challenges. Now, above and beyond that, the communication style ought to be just not laying it out on the table. It's that cascading of information. You kind of peel out the first, okay, this is what this, then you peel out the second. It has to be done in layers. And it's kind of a slow diffusion of information. And it's not that, how we tend to read in books from the West. You laid out the shared decision making, it's a one-on-one, the facts are on the table. It's not so. I think that's the third dimension that I have seen as experienced as a provider. The other things, okay, fine, you got the patient coming in this style and the provider challenges. The As you go through the care plan, over the clinic visits or hospitalizations, it tends to be very paternalistic, in the sense paternalistic from the family's perspective of some poor person, and paternalistic for the doctor needing to play all the roles. The other stakeholders or the other elements in the care provision, which Bonnie may talk about, of the social worker or the clinical psychologist or other care providers in the team, is not something that is evolved in India. Though there's a very dire and an acute need for it, maybe not all over India, at least in the cities where the capabilities are there. I don't think the medical fraternity has evolved to engage them on one side. And also the patients are not ready to have those kind of touch points. They still tend to come to the physician. So I think it's quite, um, what would you say, a significant burden as a doctor in trying to kind of, one, handle the group, the other is the style of communication, and third is handle the other elements of the care. But having said that, what do we see as changes, all of this? I think information access has become a huge game changer, that patients are able to access information on several things. And like, for example, there are good Indian patient information website that provide information in different languages of disease condition. I think that's become a great support systems, or at least information access. So you're not, putting out all the information, so they become self-informed. The next thing is, I think, again, how porous information goes across in India. People are only actively sharing each other's through WhatsApp. It takes one call from your office group from which somebody of kidney patients and you're talking to. I think those kinds of cross networks have become stronger. And the third dimension is the fact that the general education level of India is climbing. So I think that is helping too. So now when I sit across the table, as against 15 years ago, I'm having a much higher level of conversation. I think those are kind of green shoots in the right direction. But I think something like this and efforts like this is the next step. How do you bring the other pieces into the care provision? And it's not a very doctor-centric. and how do you integrate it with the physician patient care delivery model, and how do you strengthen the journey for patients is, I think, the right step. And it's excellent that that Kidney Warrior Foundation is putting it on the table and creating a conversation, so that we all kind of join hands and shape this journey, which is much needed for Indian patients and families in India. Thanks, Marianne. So I love to listen to Bonnie's journey. Thank you.
Thank you very much, Dr. Suresh. We'll now hear from Bonnie. And Bonnie, can you take us through a sneak peek of the mental health among the patients on CKD in the US? And maybe you can also tell us how is it being addressed currently?
Yes, I would love to. And Doctor, I applaud your care and concern and passion about helping people with the mental health issue. It's real, and like you said, it really needs to be addressed. So real briefly, 18 years ago, my son was diagnosed with IgA nephropathy, and not for any other reason, but not knowing anybody that had the disease, I started the foundation with my husband. 18 years later, we have over 18,000 patients in our support Facebook group. So that's really how we originated. But what brought the awareness of mental health for me and for us, our leadership team, we held in 2019 an externally led patient-focused drug development. It was to approve accelerated pathway for all these clinical trials ongoing for IgA nephropathy. It was held in Washington, D.C. in front of the FDA. We had two prominent speakers talk about the disease process and about clinical trials. But what they did was we had a panel of 10 patients, all different demographics. And we had a survey that reached out to the global community of 360 people that were polling in these questions. The number one stress factor was mental health. It wasn't joint pain. It wasn't, steroids. It was like, I'm suffering from depression, extreme anxiety. And that blew our minds. We were like, wow, we individually thought that, okay, we're feeling this, but that's because we're the only ones feeling it. It's something that it's very hard to break that barrier, open up and talk to other people about it because you think something's wrong with you, but nothing's wrong with you. It's a very common feeling that we all feel together. And just by knowing that this exists releases the burden of being ashamed. So what we did after that was we realized that how are we going to get to these patients? How are we going to let them know that we're here? So we developed a support group once a month where they can come on the call if they choose to. We now have patients that are, whether they're nurses or retired nurses that have the disease that can kind of help them through their disease process. And then one of the really exciting meetings that we held, we call it Spark. It's a patient, it's like a seminar where all of our patients came together to learn about the disease. We had speakers from all over the world, and they just went to breakout session after breakout session. And we had a caregiver session, which was really interesting. It was all caregivers. And here I am in the audience. I'm listening because I'm a caregiver, 18 years for my son. And all of a sudden, we had people crying, and you don't realize, and Doctor, you spoke about this, it affects the whole family. It's not just the patient. It's the mom, the dad, the sister, the uncle, the brother. It affects everybody. It's a big animal. So all of a sudden, they said questions, and I stood up and I said, you know what? 18 years, I forgot I was a caregiver. I started crying. And I said, I've been so busy helping patients that all of a sudden I felt this huge burden off of my chest. Like I realized like an aha moment that I've been stuffing this in too. And my health was suffering as,
Right.
stress is,
Absolutely.
it's a leader for health concerns. So after that, we went back and we thought to ourselves, we need to address 2023 at the IgAN Foundation that we are going to not only direct people to find, go find a psychiatrist, we're giving them that tool. And I hope that other people listening to this will take this and run with it also. So rather than saying, go find us, we're developing a part of our website that is called a mental health section. We're going to offer Better Life. A patient for free can have a session a week for once a month. They can find we'll give them a list of people that have been vetted that will be able to talk to them. And if they're not happy with that person, they have the opportunity to choose someone else. That person will go with them on that journey. Then we're also on this website, we're also doing, it's called Calm. I'm not sure if you've heard of it, but it's a Calm app. So our patients will then be able to download meditations. There's a whole library of things that they can download. And then the other thing we're extremely excited for is the app that they can take with them, that if they need this on the road, wherever they might be, they have those resources with them. And then last part of this that we're really excited about is we're going to be offering live meditations and live yoga and little spiritual, depending, like it's for everybody. If you're an engineer, you just want to talk to somebody, you don't like yoga, then you can choose that part of the app. So we're very excited about it. We're rolling it out in 2023. It's in the process right now. We're aligning ourselves, signing off and making sure that, patient information is protected and all of that. But we're very excited about it. And it is something that I think all organizations owe it to their patients if you take that on to be there for them. And honestly, 18 years it took me to realize that this is really, really a problem. And if we address this, since IgA nephropathy is very much stress induced, then look, we may be able to slow the progression. And I just wanted to add, before I pass it over, that 30% of our patient population that has IgA nephropathy is Asian and South Asian. So our focus has been, which is why I met with Sandra, and we're also working with our Asian community in the US and globally, that we help them. They need the resources and the tools, which is why I'm so embracing with our Indian patients. They have reached out to me through social media and, we don't have money and my brother has IgA nephropathy, please help us. And I literally was like, I have to do something. And that's when I met Vasandra and the Kidney Warriors Foundation a couple of years ago. And I feel very blessed to be part of this wonderful community. So thank you.
Thanks, Bonnie.
Thank you, Bonnie. Dr. Suresh, today you've given me a very, very new perspective, actually, I think, of mental health, because being on this journey for 12 years, I've never seen it from this perspective, because you've given me a perspective of, one is how the country functions, the systems in the country. And the second thing that you spoke about, which was very interesting, is the collective, the culture in which we all function from, the collectiveness, the family coming together, and the disease belongs to everybody in the family. A little more what you can even experience in the US, because we have a lot of people here in India, so we can share everything, right? So my understanding is patients don't really look for support systems because they have enough of people in the family willing to share this burden. But I'm also, today I got to understand this collective functioning, how much it actually could be burdening the patient, because the patient is not empowered over here to take decisions on his own. So he's sitting in the conductor's seat on the vehicle that he's driving. And I'm understanding that could actually be really difficult for the patient, right?
Yeah, I think, that apart, sometimes decision making, right? Do
Yeah,
you
yeah.
use this therapy? Do I want to, do the next step of diagnostics or whatever?
Yeah.
Sometimes collectivism can be a kind of
Absolutely.
It can slow down and it can
Absolutely.
cause a little bit of
Absolutely.
chaos.
Yeah.
And I think the paternalism in our internal system is sometimes can be a hurt.
Absolutely. Absolutely.
There are limitations, but I think everybody is learning. So
Yeah.
it's an
Yeah.
evolving situation. It's
Yeah.
not static.
Because while you're saying that, I was just working on a project on mental health with caregivers, and I did a survey with 50 caregivers on the journey of CKD, and I see that most of the caregivers are dealing with guilt, right?
Mhm.
And that's another side of mental health, which is, and this need to be strong all the time. They need to hold the fort.
Yes.
And that's from a caregiver perspective. And today I'm seeing that there should be a lot of guilt on with the patient as well, because the need for him or her to take a decision that would suit the convenience of everybody in that collective functioning could be quite overwhelming for the
Exactly.
patient over here as well. Because
Absolutely.
when
Yeah.
the decision making that you're exactly talking about, and this seems to be so complex because we're not talking about an individual over here, we're completely talking about a system and a culture. So
Correct.
how do you see us moving from any direction? Because I'm sure we cannot change the way we've been functioning for so many years, because it also works in our favor. This collective functioning also works in our favor. In many ways, especially when you really want someone to talk to, you don't need to make a call. You have 100 people that you can go to, and we have all the time to speak. And that actually works when we're looking for empathy and sympathy. But, Doc, from a doctor's perspective itself, how do you think? Because you're looking at so many families every day, and changing the system is a long way to go. Again, how do you think that we can actually make this change? And Bonnie, as you're looking at it from a very third person, this discussion, your viewpoints as well.
So if I could go first, I think, cultural change is not something that's going to be radical, and it's not going to be fast. It's going to be nudges and pushes, and we'll move by inches. I think it ain't easy. So what I tend to do and doctors tend to do is just negotiation with the group, saying that, trying to make them understand that, hey, let's listen to what the patients or the patient individual, who's the center around which everything is revolving, let's listen him out. And it takes a lot of communication skills to put his views in front and above everybody else's. I think it's an art, even as a clinician, that I've learned over years. It's not something that comes easy when you're a doctor. The other element, I think, is now, since we have more facts in the open, I think that has become a more powerful tool. We could share information. I mean, for example, there are, right from medical articles that gets published, those are sort of distilled into what is it for patients. The Lancet does it, so many other medical information. So we're able to present facts better. I think that's become a very powerful tool in current context. So it makes it more objective in our conversation. I think the third nuance is you got to invest the time to work through the family's pathway. I think those are three things. It's communication, it's information, and kind of the time. But I think where sometimes the difficulty comes is when there is a time matters in clinical decision making. I'm not talking about an emergency. I'm talking sometimes what can be done in a week, sometimes takes us 3 to 4 weeks. I think that's where we still need to get out better. That's what I would say. And I think you need to give Bonnie in India, whom you marry, the house you invest in, your health, all these are big decisions. Those are never individual. It's a collective. And that's not something that, you would change soon.
Yeah.
Still, I think the data shows that 80% of Indians don't choose whom they want to marry. It's kind of chosen by the family, right? So
Yeah.
Health, I'm sure, is roundabout there in terms of percentage.
Yeah.
Right? So,
Bonnie, how does this sound to you? Because over here we're talking about the culture difference and the way we function. We function from the we all the time. Every decision is based not for the individual, but every decision is based for the society over here. And in the US, every decision that is based is always coming from an individual perspective. That itself is such a huge difference. And looking at it and
Yes.
listening to our discussion, what is the view that you would have to give us?
is she muted? I mean, there's a connection issue for Bonnie.
I think. Hello, can you hear me?
Yeah, Bonnie, can you restart?
Can you hear me now?
Yep.
I think the way we're headed right now, the collaboration between us needs to stay open and we can keep learning from each other. But I do feel that having a conversation like we're doing right now, and the more conversations we have, the easier it's going to be for people to embrace the change. It's just going to take time, like you said. Nothing is going to happen overnight, but little by little, we're taking these really important steps that we never did before. I was thinking when you were talking, Doc, the World Nephrology Congress or the, American Society of Nephrology, maybe it would be great to start at that level, having a session, one of the meetings that you go to about mental health and CKD. I believe that when our patients go to see their nephrologist, the doctor will come into the room and they'll be like, so how are you feeling? Good. No, you could be falling apart. Everything hurts. I'm depressed. I can't eat, sleep, but they're saying good because that's a natural instinct. Nobody wants to just throw up on somebody all of this horribleness, right? So we have a tendency not to tell the truth. So really, the doctors are not aware that we're struggling. So it really needs to come at that level where we're letting the doctors know that there's a struggle and it's a very real struggle. And we give them the facts. I have the whole guide on the ELPFDD that was in Washington. There's survey results. I would love to send that to you just so you can see how think at that level by letting that the doctors know that this is really, really scary and frightening for the patient. I think it would be a really big step in our favor. And then we can do the advocacy work on the other side by letting our patients know that when you go into your nephrologist, be honest, let them know that you're not okay, and then like I said, it's going to take us time, but we'll get there because any conversation gets the ball rolling. So I'm confident that we're going to get there. We just have to take it as a major part of our mission. And it's not to be put on the side, it's to be part of our mission. And that's what we've decided to do here.
I think, my suggestion, if I may, is I feel we kind of need to work further upstream to the younger nephrologists and even trainee nephrologists, where
Yeah.
I think there's doctor-patient communication issues. I think in U.S. schools there is some emphasis, but in Indian med schools it's not part so much. But that's one thing. But I think when you are a trainee or a fellow in a particular specialty, right, be it onc or nephro, you really need more emphasis on what it is these set of patients come through with different diagnoses, and what is the what ought to be the engaging style, and what is that you should be able to get through in your conversations. We're not there. I think there's a huge area. Like I could tell you, when I was a fellow, Bonnie, I trained in the US, so sort of I did my residency and fellowship in the US. So we didn't have much of this, okay, fine, if the CKD diagnosis, even choice, even when we talk about options when advanced kidney care, we don't do it. The nursing team does it. We send it to the options team and then they come back, So it on the training side, it's enough ain't happening. So, like in Indian context, for the conversation, since you talk about the doctor patient, I always get into the icebreaker for the first 2 minutes. It's about, I generally know what their life is about. So I'm generally asking about that. And they'll usually kind of ease out in the next 2-3 minutes. And then I said, okay, now what's between you and doing what you like? And I kind of then roll over into the symptoms of the disease at the end. So kind of starting from who they are and what they come. But that's kind of, I take the reverse approach. I start with their life and then come back to the symptoms. It's something that
I think that's wonderful. I think that's wonderful what you're doing. And I think that you should be the role model of what going forward looks like, because you have all that. You're treating the whole person.
Yeah.
You're not just treating the kidney. Yeah. You're treating the whole person. And I think that's very important. And I agree with you with the fellowship because they're fresh. They want to learn. They're so eager to please, and they're just right out of school, and they're ready to save the world. So I think getting them at that level is a key point.
Yeah.
To have discussions and have a speaker to come and let them know that, or have a couple patients, CKD patients come in and be on the panel to say, wow, you have no idea the struggles I've been through. Because when we do that, when we bring a patient panel to any of our doctors, especially at the ELPFDD, we had the University of Alabama, Birmingham crew there. They're like leaders in IgA nephropathy. And they could not believe how steroids were affecting the patients that were up on the panel. They were like shocked that you had a 12-year-old little boy talking about Moonface and how kids were making fun of him in school, and that he
Right.
hurt all over, and that his legs were swollen, and that his feet, and then another little girl had to give up dance because her bones were
Right.
brittle in her feet. The doctors, they were, and by the way, steroids was the only thing available, but to hear the patient perspective was an eye opener. So I do believe that by bringing patients into this journey and our mission, it'll really open some eyes.
Absolutely. Okay.
Thank you very much, Bonnie and Dr. Suresh. So what I'm taking away from this conversation is the importance of us to start as an organization dialoguing with nephrologists, and this need of mental health as a very important part of the journey on CKD, and how the nephrologist can actually start dialoguing with the patient, and like you said, treating the patient as a whole and just not the kidney itself. I think that is going to even create a scope for the patient to start talking beyond CKD, and maybe that being directed back to a specialist that can actually help the patient on that part of the journey is the best that I could take away from this conversation. But it's interesting to see two countries coming from two diverse cultures, facing the same issues, similar issues, and and I'm hoping that our collaboration moving forward and learning from each other is going to help patients deal or even see the importance of this factor on the journey of CKD. So, on behalf of Kidney Warrior Foundation, I'd like to take the opportunity to thank Dr. Suresh and Bonnie for joining us today. And I'm hoping the patients are going to really enjoy the session. Thank you.
Thank you. Thanks, Marianne. Thanks.